Acknowledgement.
We respectfully acknowledge that the County of Haliburton is located on the Treaty 20 Michisagi territory and in traditional territory of the Michisagi and Chippewa Nations, collectively known as Williams Treaties First Nations. We acknowledge the shared presence of Indigenous nations throughout the area and recognize its original inhabitants as stewards of its lands and waters since time immemorial.
Thank you. Any disclosure of community interests? Seeing none, Gary. Agenda?
That the September 10th, 2025 Haliburton County Council agenda be approved.
Have someone move? Councillor Shell, second by Councillor Dayu. All in favor? It's carried. Thank you. The consent agenda?
That the items listed under the heading consent agenda for September 10th, 2025 be adopted as presented.
If someone move, Councillor Danielson, second by Councillor McKechnie. All in favor? It's carried. Office of the CAO, project update, County of Haliburton strategic plan. Ladies.
Good morning, Warden Burton and members of council. We are here this morning as co-leads of the County of Haliburton Strategic Plan project to update council with our team's progress thus far and to discuss next steps as the project continues.
As you know, but for the benefit of those watching online, under guidance of council, county staff are developing a new strategic plan to guide priorities, decision-making, and service delivery at the county in upcoming years. As an upper-tier municipality, the County of Haliburton plays a key role in coordinating services, supporting local municipalities, and addressing interjurisdictional issues. The plan will provide a framework to align departmental work plans, focus resources, and be responsive to evolving opportunities and challenges. Overall, the strategic plan project has been broken out into 3 phases. Phase 1 being the project initiation phase, phase 2 being the research and consultation phase, and phase 3 being the plan development phase. First, we'll touch on the first phase, which is complete project initiation. The project initiation phase consisted of 4 parts. For the first, the working group met for a kickoff meeting and drafting of the summary report. At the kickoff meeting, group members who represent a variety of departments at the county really focused first on becoming familiar with each other, as we don't normally have a chance to work closely together. As well, we introduced the concept of strategic planning to the team and discussed what the process was planned to look like. The summary report referenced was the staff report that went to council last August, outlining the entire project for your endorsement to move forward. The next developed a communications and engagement plan, which generally set the foundation for the work being completed in phase 2. The next phase of the project is the research and consultation phase, which we are currently in the last stages of completing. The first component of this phase is the environmental scan undertaking, which I'll elaborate on in a moment. The other component is the detailed consultation strategy, which Sue will elaborate on shortly as well. As background, the environmental scan and the consultation results combine to create an overall guiding document focused on the strengths, weaknesses, opportunities, and threats or complications, I guess, of an organization that helps form the strategic plan itself. The environmental scan undertaking is the activity of finding, gathering, interpreting, and using information from the internal and external environments of an organization to help direct future action. With that, we focused our efforts on finding information related to PESTLE, which stands for the following categories. Political, so that includes federal, provincial, and regional priorities. Economic, which includes budget review and fiscal capacity. Social includes demographics and growth, housing and employment. Technological, kind of self-explanatory. Environmental includes climate change, green development, sustainability, and infrastructure. And legal or legislative, which includes recent legislative changes from the province or other similar components that could impact the strategic plan. And with all that information, it will be combined to provide one half of our coming What We Heard report at the end of this second project phase.
Alongside analyzing existing data and performing environmental scans of documents, plans and policies already in existence, our working group team began developing our consultation strategy. I should note that our full working group did not always work together on each piece of this project, as we coordinated around schedules, skills, and interests. Our goal was to gather diverse perspectives to inform the county's strategic priorities, ensuring the plan reflects community needs, values, and future aspirations. We were looking for feedback from municipal staff from both the county and each of the 4 local municipalities, offering internal insights on operations, challenges, and opportunities, broad public input across demographics from residents, and detailed input from community members representing collective interests in community group sessions. Our methods of engagement included small group interviews and surveys, inviting staff, community groups, and the broader community to be part of this plan. Our in-person groups and survey focused on SWOC, or strengths, weaknesses, opportunities, and challenges analysis. And our survey asked for feedback around satisfaction with living, working, and playing here, community priorities, county service improvements, environmental support, population growth views, and strategic priorities. The interview guides for these sessions and survey questionnaires were developed with great consideration by the working group and in consultation with our senior management team, who serves as the steering committee for this project, and our county CAO. We waited for our partners at Minden Hills to complete the consultation strategy phase of their own strategic plan initiative prior to launching the county's consultation efforts to avoid confusion or survey fatigue from residents. While we will bring forward a more detailed What We Heard report in the weeks to come, as Elizabeth mentioned, we can share that we were deeply satisfied with the quality of community input that we received, which provided diverse perspectives, leading our team to be able to develop a more informed and balanced plan. We are very grateful to the community members, including service providers, who were able to take part in our community engagement efforts, and to both county and local municipal staff partners for taking the time to meet with us for 2-hour in-person sessions in which they shared thoughtful, honest, local knowledge. It was a great privilege for us that we were able to meet face-to-face with so many of our community members and colleagues who we sometimes only work with through phone calls and emails. And one of the benefits of having an internal staff working group is that while we were gathering information for the strategic plan, we were able to discern feedback that, while it might not fit into the strategic plan project, it was still important to hear and bring forward for consideration in separate reports internally so that we can all work best to serve our communities. Some of these ideas are able to be implemented immediately. We were left, certainly after every staff meeting, with a deep regard for the quality of staff members working throughout the county and their love and care for this community. To share a high-level look at the consultation we engaged in over several months. In October, Council met with members of the Strategic Plan Project to undergo a SWOC, or SWOT, in which the T represents threats rather than challenges analysis. This session was led by CAO Gary Dyke. Again, we appreciate the quality of feedback and authentic input offered that day, given your own expertise and experiences of this community. A priority shortlist session was then held on December 4th in Council chambers. At this session, we worked together to tentatively identify the areas of focus that will form the basis of the plan. Next month, we will present the What We Heard report to Council, and at that time, these areas of focus will be revisited to determine whether they should remain as is or be adjusted based on further input. We met with our senior management team in November to thoroughly review community engagement pieces and to conduct a SWOT analysis with our colleagues. At a February 19 all-staff meeting at the county, we shared a presentation with our colleagues about the Strat Plan project, asking for participation in the internal staff survey and detailing the in-person group interviews that were to come. There may or may not have been chocolate incentives, but we would like to note that we did have staff reach out to us to ensure they could be included to take part in consultation efforts. In-person group interviews were organized carefully, taking into great consideration schedules, especially those of our public works and paramedic teams, thanking those who helped organize those group sessions. We conducted 6 in-person sessions with a randomly selected group of 10 respondents coming together from a mixed selection of departments from the county. This in itself was a unique experience for all of us, again, to be in the same room together, with some respondents attending at the start of their shift and some attending at the end, and some respondents having worked at the county for less than a year, while others had devoted decades to their work. We held these sessions at the Haliburton Highlands OPP Detachment Meeting Room and thank our OPP partners for that space. We also met our library staff colleagues separately for another 2-hour session. These sessions were held at the library before opening, my dream of being locked in a library somewhat fulfilled. And we are thankful for the library staff who were able to join together on that day for insightful reflection from throughout the county. These such sessions took place between March and June and were delayed due to state of emergency operations as a result of the ice storm earlier this year. Prior to staff in-person sessions in February, we invited staff to participate in an internal online survey. These responses could be made anonymously and offered staff an opportunity to respond, even if not participating in focus groups. After county staff in-person sessions had been organized, we took our SWOC analysis on the road and visited each of the local municipalities to conduct a similar 2-hour discussion and exercise. Again, thanking local CAOs for their help in organizing, staff for their participation, and to all for sharing their time around ice storm and state of emergency operations. Our public survey launched in May and was open for 3 weeks. As it launched, it was advertised through multiple means to the community. In addition, paper copies were available at local libraries or by request from residents. The survey clearly outlined county responsibilities in the preamble of the survey to ensure responses were most appropriate to the upper tier services. Participants were asked to rate satisfaction with living conditions, detail community priorities, and express opinions on topics such as population growth, environmental initiatives, and strategic priorities. We held 2 in-person group sessions in May and June with representatives of community groups. One session was held at the Haliburton Curling Club in the evening, and the next session was held in the afternoon at the Minden Hills Community Center. Respondents represented a diverse range of groups and interests. We also facilitated one online group session in that same time period with service providers through the Haliburton County Service Providers Network. These group sessions were engaging and followed with positive feedback from participants. For community group members who were not able to attend an in-person session, we offered a community group survey to be submitted by a representative from their group. This ensured we were collecting information through different formats, and that if the dates or locations of in-person group sessions were not ideal for respondents, they still had an option to participate and share their important feedback.
So moving forward, the working group has committed to bringing the What We Heard SWOC summary report to council at the start of October. This will combine all of that consultation Sue just went through with council, as well as the environmental scan. And at that time, we will be looking for feedback. We will be looking back at the feedback we received at the December session with council to determine if the areas of focus brainstormed at that session are still valid and relevant to continue with, or whether they will need to be adjusted based on the results of the report that is presented. Once we have the feedback from council in October, we will be in a great position to move forward with phase 3 of the project, the development of the plan itself. This slide might be a little bit difficult to decipher on the screen, but the Gantt chart is available attached to the staff report for your closer review. What's on the screen is the process moving forward. What's happened to date has been clipped out. The key touch points with council after October include another council workshop in January to really hone in on the details of the plan and priorities of council. The final draft of the plan will then be presented to council in February, and then pending no further changes, or no major changes, I should say, then the final presentation of the plan will occur in March, and implementation of the plan will follow once council has approved it. And with that, we thank you for your time today and are happy to answer any questions you might have. Thank you.
Gary, go ahead.
Thank you, Warden. I think before we get into the questions, I think it's important to recognize the outstanding work that Sue and Elizabeth have done in putting this together and the team put in place. It's a bit of unusual that we're doing the magnitude of the study in-house, but the work they've done is outstanding. I think the quality of product is going to rival that we would have gotten going to consultant. Yes, it's taking a bit longer. We were throwing a couple of curves in the middle with the ice storm and other things beyond our control. And then with also they still have their regular day jobs to do as well on behalf of the county and the local municipality. So I think it's important to recognize the efforts that have gone in and the quality we've gotten to date.
You stole my thunder. But I also thank you so much for the report, and thank you for what you've done to put it together. And Gary, to you as well. I know you've had your fingers in it as well. So thank to all. Questions? Counselor Carter.
Yes, thank you for this. I think when we started along this road, you know, the decisions that we made to go forward in this way, I don't know, makes it a lot more personal, a lot more personal to Haliburton County, if we can call Haliburton County a person. And I think that's important. Um, one of the things as we start through budgets and so on, uh, the world has changed. And the world has changed pretty dramatically. I'm particularly concerned with, for instance, last year we had a major increase in our OPP costs, which the provincial government at the last moment, threw us some money to reduce what that charge is. We have no idea what is going to happen this year, but there's no doubt that over the next coming 3 to 5 years, we are going to be hit with significantly higher charges than we've had in the past. If we look at things such as housing, social services, child services, the cost of those services and how we organize them are probably going to increase greatly. If we look at our asset management plan, um, I'm not really certain that even 5 or 6 years ago, people were thinking of $1 million fire trucks, which is, what we're facing today. I think we're probably all behind on our asset management funding, if you will. Um, so I'm almost thinking that we need to have something, some discussion about general financials going forward for, the county. And I'll just lump all the municipalities in together with the county. I I guess the question is are we going to be able to afford what we have 5 years from now? And that obviously impacts this tremendously. I know that we have looked at the monies that are involved in doing each of these initiatives, but I think the overall and overarching financial situation is going to be incredibly important. I'm certain that there's an awful lot of municipalities across Ontario that just aren't going to be financially viable, 5 years from now. So.
Gary?
Thank you, Warden. Through to Councilor Carter, your points are well taken. I think that's one of the great outcomes of this study or the programs being put in place now, because it allows us to take basically the projections or the wishes of the communities for growth in different areas and things they want, but allows us to actually go in and both quantify and qualify them in a prioritization of going forward to what it's going to cost. And while this plan won't be ready for this year's budget, but we are taking the information in its unfinished form and using it for projections going forward. And I was mentioning to Councilor W this morning, is now we're able to go forward and even in a much greater level when the strat plan is done itself, we can start projecting out those costings. So basically monetizing the plans going forward, we can have a pretty solid projection what 26 is going to cost, what 27 is going to cost and beyond going forward. So allowing council and the community make more informed decisions as to what we're actually doing over the number of years and any changes we have to make to be sustainable, to be affordable as we go forward. So that's kind of the base level foundation of this plan going forward. It allows us to do that in an informed fashion. But it is a point well taken, and it is one of the things that does keep me up at night when all the numbers start running through my head.
Other questions? Councilor Ryle.
One of the things I'd like to, when you buy anything from a consultant, you either get pounds of paper or thousands of words. You don't get much of anything else, in my mind. What we're doing here is a whole lot different. We're getting down to what we need to hear, not what we want to hear. And I think that's the most important part of this whole exercise, is that we're now going to know what is facing us. And if I'm not mistaken, and I trust the staff beyond understanding, is we're going to get options on what we need to do, and we're going to have to sit here and make decisions on which direction we're going to be going in. and the cost of doing and not doing something. I understand thoroughly that we can't have that by the 2026 budget. Having said that, it's nice to hear that we're going to get some introductory to it, but I certainly look forward to a 2027 if I'm around, where we can actually get into this in much greater depth. So thank you guys very much. I like the ambience and the whole concept of cooperation and communication that you guys are doing amongst yourselves and amongst the various municipalities. I can't see anything but good things coming from this.
Okay, other questions or comments? Councillor Danielson.
You say that with caution. You know, one of the things that I was concerned about when we first decided that we were going to go with the staff-driven strat plan, I was concerned about the viability of that. I can see that the work that's being done really is extraordinary, and I can see the benefits of working internally with this. I'm still concerned about the impact that this has on our planning department, where, you know, we're short-staffed on staff that this does not fit into their job description. That I think that we've added a burden to staff by doing this, but I can see the benefits, you know, even though they will take a little bit longer. Speaking to Councillor Carter's comments about finance and how we're going to deal with our financial picture going forward, I can't emphasize enough the importance of us all really and truly looking at the importance of service delivery and how we need to, you know, really pay attention to that in order to help us manage, you know, some of those financial challenges that we're looking at going forward. I really look forward to hearing the result, that, you know, further results. The only question that I would ask, it would appear that you know, that you've done a lot of consultation, which is great. You've spent, you know, a lot of time seeking out, you know, thoughts and ideas from outside groups and organizations. You've spent time talking to municipal staff, but I'm wondering, you know, how much time was spent talking to municipal councillors. And I don't mean county council, but I mean the local councils. I can see that there might be some benefit from that because the thinking was different between councils sometimes and staff as to what priorities need to be followed, and ultimately it's council's decision about the direction that they take. So, you know, I kind of see that that might be a little bit of a missing gap.
Any comments?
Just that I mean, given that it's the county plan itself versus our one, it would be a bit unusual to do that way because we're getting the local voice from this body. But I mean, that's as we go forward with the what we heard plan. I mean, those could be some valuable inputs. If you're not seeing something that you think would be applicable, then we can actually mine down a little further into it and do it at that stage. I think we could do it that way. But that was kind of the philosophy around, is we are getting the local flavor from the staff level, but also from the county council members, and your dual hat role between representing the county and the lower tier. But I think we can mine, as I mentioned, we can mine down greater in that when we start reviewing the who said what or what we heard report that comes forward to council.
Other questions? Resolution?
That report CAO 09-2025 project update, County of Haliburton strategic plan be received as information.
Have someone move? Councillor Danielson, second by Councillor Ryle. All in favor? It's carried. Thank you. Thank you. So we're down to report from closed session of August 27th, 2025. Wendy, I would ask you to come up and join us if you would at the table. See you.
It just be, well, Wendy can present a report to council.
Okay.
Good morning, Warden and members of County Council. I'm very happy to bring before you today a report regarding medical service agreements for Dr. Mario Lupo, Dr. Carly Eisbrenner, and nurse practitioner Cicely Cooper. The Dr. Mario Lupo is a family physician, and he's made a commitment to the Haliburton Highlands Family Health Organization for full-time practice starting next week, September 18th. Dr. Lupu has signed a return of service agreement for 4 years, and he'll be assuming the practice of Dr. Norm Bottom, which is 1,287 patients, and Dr. Bottom will be retiring at the end of this month. Although Dr. Lupo will not be rostering any patients, without him, these individuals would be left without a family physician. Dr. Carly Eisbrenner is also a family physician, and she's made a commitment to the Haliburton Highlands Family Health Organization and Haliburton Highlands Health Services for full-time practice commencing on November the 1st. Dr. Eisbrenner has signed a 6-year return of service agreement, and her practice structure will be a combination of rostering 700 new patients in the clinic, as well as caring for acute inpatients in the hospital and taking emergency shifts. So more like full scope rural medicine. And Cicely Cooper is a nurse practitioner, and she has made a 2-year commitment to the Haliburton Highlands Family Health Team for 0.8 full-time equivalent position, so 4 days a week. And she's starting on November the 1st. So Ms. Cooper's primary responsibility as a nurse practitioner is to provide care to unattached patients. And the plan for her is to assume the care of between 480 and 640 residents. However, this will depend on patient acuity. So this is all great news, but there's still plenty of work to be done yet because the clinic is still needing at least 4 more full-time physicians. So we're still working away at things. And I also wanted to comment too that it's interesting to note that the recruitment process for Dr. Lupu and Dr. Eisbrenner has taken a full year. And this is about what usually happens. This is kind of the norm from the first time they contact me and reach out to go through all the steps and then coming to visit. And for Dr. Lupu, because he was working in the UK, working on licensing and all of those steps. It just takes a long time. So it does take a lot of patience on both sides, really. And I wanted just to give you just a brief update as well on a marketing project that I've been working on for a while, and that's a video production. So it's just been completed and it's just beautiful. I'm really happy with it. In this video, there's one longer segment and 3 shorter segments, and they feature 4 of our local doctors. And it's video interviews of them talking about why they came here, what they love about working here, what they love about living here. So it's showing them in the community and also in the hospital and the clinic. And it turned out really well. So Dr. Carly Eisbrenner, one of our new doctors, is in the video. So I was waiting for this to be wrapped up so I could release that. So it will be released this week on social media and my website and all of the marketing that I'm doing. And I will be bringing a full update to council in November. So I welcome any of your comments or questions.
Thanks so much for the report, Wendy, and
Yeah.
thank you so much for what you're doing out there for us on our behalf. Questions? Resolution.
Staff report EDT 12/2025 medical services agreements for Dr. Lupu, Dr. Eisbrenner, and nurse practitioners Cooper be approved.
If someone move, Councillor Ferry, Councillor McKechnie. All in favor? It's carried. Thank you.
Thank you.
Thank you. Confirmation by law.
That bylaw 4314 being a bylaw to confirm the proceedings of the September 10th, 2025 meeting at County Council be considered to be read a first, second, and third time.
If someone move, Councillor Carter, second by Councillor Dayu. All in favor? It's carried. Adjournment.
That the September 10th, 2025 meeting at Haliburton County Council be adjourned at 9:31 a.m.
If someone move, Councillor McKechnie, second by Councillor Dayu. All in favor? It's carried. Thank you.